Medicare versus Medicaid. What are the differences between the two of them and how do they work together? Hi, my name is Jo Hutchison. I am an independent health and Medicare advisor with Founders Life and Health. We are based here in beautiful St. Louis, Missouri, but we help people all over the country with their Medicare and individual health choices. So today we are going to talk about Medicare versus Medicaid. I often have people get the two confused or just generally don't know what each is or how they work together. So that's what we're going to talk about today. So let's start with Medicare. What is Medicare? Well, just an easy definition for Medicare, it is a federally based program, mostly for people that are 65 and older, but it is also available to anybody under 65 that's on disability. It is generally used, most of the people that use Medicare are 65 and older though. If you want to learn more about Medicare, I have a whole video that I'll put a link to right here that's going to tell you everything you need to know about Medicare, the basics, how much it costs, how you need to enroll, all those things. So that will be linked right here. But for the purposes of this explanation, Medicare is a federally based program, generally for people 65 and older. So then what is Medicaid? Well, Medicaid is a little bit different in that it is a state-based program. All of the Medicaid programs in the country are going to be run independently by each state depending on where you live. It is also not based on your age. It is more available and based on your income. So when you are applying for Medicaid, they will be looking at the amount of income you have versus how old you are. In order to qualify for Medicaid, you have to apply for Medicaid, and a number of criteria have to fall into place. One, you have to be a citizen of the United States. You also have to be a resident of the state in which you are applying, because like I said, Medicaid is a state-based program. And you are going to have to qualify, your income is going to have to qualify. It's going to have to be low enough that the state deems that you are in need of additional assistance. Something important to remember as far as Medicaid goes is that depending on the state that you live in, it might be called something different other than Medicaid. So for example, I have clients in Tennessee, and in Tennessee, the Medicaid program there is called TennCare, Tenn Care. Here in the state of Missouri, the Medicaid program is called Mo Health Net. So every state is they might just call it Medicaid, but they might have their own kind of branded program. So if you hear somebody else talking about, if you're in Tennessee and you hear them saying that they're on TennCare, that is Medicaid. It's just branded differently in the state of Tennessee. So if you need assistance looking into what's available in your state and you're not exactly sure what it's called, you can obviously Google that. You can also reach out to somebody like myself that can help get you in touch with those resources. But just to help clarify some of the confusion, it's not always just called Medicaid. One added piece of info about Medicare versus Medicaid is that they can actually work together. You can be on Medicare and on Medicaid at the same time. So if you're over 65 and you qualify for Medicare and you also financially qualify for additional assistance through your state, then your state can coordinate directly with the federal Medicare program so that you are getting assistance from both simultaneously. So if you are on Medicaid currently and you're getting ready to turn 65, you will want to consult with somebody to help you figure out which plans are going to work best to put both together, because you will have one of those special needs dual eligible plans. So there are going to be lots of different options. All of the major carriers carry dual eligible plans, so you can talk to me, you can talk to anybody in your area that knows a little bit about how the special needs plans work and have somebody get you enrolled in something that will have both plans working together. Hopefully that was helpful. I did want to make it short, sweet, and to the point. If you have any additional questions or if you need help figuring out how to get your plans to work together, please don't hesitate to reach out. Like I said, we're based here in St. Louis, Missouri, but we work all over the country and our services are free to you. So don't hesitate to ask any questions, and thank you so much for watching.